Hello, I'm Dr. Dennis McKenna. I'm joined again today by Dr. Venditti, our hospital system general director, giving you the update from Albany Medical Center on the situation related to coronavirus. Today is Monday, March 30th. Fred, we opened up Incident Command 22 days ago.
22 days ago.
You asked for it to be opening up, and it's been open 24 hours a day for 22 days.
That's right.
Today in Albany County, speaking to Dr. Whalen, they are reporting 205 cases positive for COVID-19. Now that's the number since the beginning. Many of those patients we can believe have gone on to full recovery, but 205 is the number for the full period. We'd like to talk about what's happening inside here at Albany Medical Center. From the beginning of the time that we have tested, we've had 127 positive cases. We've tested people in our tent, we've tested people in our emergency department, and we've tested people in an inpatient setting. That's where I'd like to focus today. We've had a total of 36 patients during this time who've been positive for COVID-19 in the hospital. Of those, 15 have been seen and discharged, so that leaves 21 currently here in the hospital. 12 of them are on the floor, 9 of them are in an ICU setting. Of those 9, 5 of them are on a ventilator. Today we're wearing shirts from our surgical department because we do in fact have a patient now on one of our surgical floors. We mentioned last week children who had come and been discharged. We mentioned a woman who was in labor, and we are reporting that there is a patient on our surgical floor, not surprisingly because it's in the community, and the surgical floor is caring for that patient as well. We speak every day to the hospitals in the county, and today that number is 82 over the 12 hospitals. You lead that conversation.
That's right. 82 patients in the hospitals. There are 12 hospitals that are on that call every day. 22 of those patients are on ventilators, and we're keeping track of that as well, Dennis.
Okay, very good. Today we'd like to focus on two main topics. We want to speak about healthcare workers at Albany Medical Center who may have gotten COVID-19, and we also want to talk more about PPE. So let's start with the first one, Fred. Talk a little bit about if you're a healthcare worker or an employee at Albany Med having COVID-19.
So Dennis, we both got an email from one of the nurses in the hospital asking us this question, and it's something that we're definitely not withholding, but we haven't touched upon. So as of today, we have 45 healthcare workers of the Albany Med family who've tested positive for COVID-19. 2/3 of them, or 30 of them actually, contracted that outside the hospital in the community, and about a third of them contracted that inside or in contact with others here in the hospital. And even those index cases started outside the hospital. There are 141 healthcare workers who've been exposed, who are wearing masks and checking their temperature twice a day. If you think about it, Dennis, we employ 10,000 people to only have 45 healthcare workers positive for COVID-19. It's a pretty small number.
It's a small number. And the process to coming back to work is pretty well established. So we know that if you are somebody who has COVID-19 and you're a member of our healthcare team, that in order for you to come back to work, there's certain criteria you have to meet. The first thing is that you have to be out of work at least 7 days from the onset of your symptoms. Secondarily, you have to be fever-free for at least 72 hours without taking any medications at all to reduce a fever. And the third thing is when you come back to work, you have to wear a mask for up to 14 days from the onset of the symptoms. And we won't let someone come back to work without being cleared by Employee Health Service and epidemiology, and we track them going forward. So as we have employees who are positive, we put them out safely and we return them safely.
That's right. And those are the guidelines from the Department of Health, the New York State Department of Health, that we're following.
Okay, very good. The second topic we want to talk today is about PPE. Now, Fred has mentioned in the past that we have enough on hand. What we want, though, is a solution that allows us to continue to have enough to care for the population going forward. I'm going to start by talking about surgical masks, and then Fred will pick it up from there. I want to remind everybody that our epidemiology team, our infection prevention specialists, are looking at all the published guidelines by the CDC. The surgical masks that we see people sometimes wear in the hospital, there's only really 3 indications to wear those. The first indication would be the same indications that occurred before there was COVID-19. We know what those are standard precautions. But today we would expect that if you are somebody who is taking care of a patient with COVID-19 or a patient under investigation, and you're having direct patient care, those people should be wearing a surgical mask as well as eye protection. And the only third reason why we would expect someone to wear a surgical mask is if they're directed to by epidemiology. So those are the indications for wearing the surgical mask. In addition, I think you wanted to talk today about extended use and reuse.
So again, we're trying to conserve those masks that we have. So we're going to do two things which we believe are appropriate in terms of both extending the use of masks as well as reusing them. So extended masks first. We're going to begin to cohort those patients who are positive and those patients we suspect might be positive. And then the individuals working with those patients will wear a surgical mask with a face shield. So that's a plastic shield that will cover their mask. We believe that will protect the mask from being contaminated, and therefore they'll be able to reuse that mask or continue to use that mask for an extended period, perhaps 2 or 3 hours. When they want to go to the cafeteria to get some food or need to take the mask off for some purpose, they'll discard it, put a new mask on, but they'll be able to go from room to room of the cohorted infected patients with that same mask. Okay. So that's extended use. Reuse is a little bit different. Reuse for the N95 masks, they'll be used the same way with that face shield, but the N95 masks can actually be sterilized using UV light. So we'll have nurses and others that use the N95 masks put their name on the mask. There's a whole procedure of how that would be doffed, put into a bag, and then we set up a process for that to be sterilized and then brought back to them or made available to them for their next shift.
So a couple of things. It'll be the UV light that will disinfect them is True-D, and we've used that for several years.
We've used that for many years, and this is a procedure that's used at the University of Nebraska Medical Center, which is the Ebola Center for the United States.
And the program you're talking about is one that's been signed off by epidemiology, facilities, environmental health and safety, all of our groups working together.
Everyone that's needed to look at this has looked at it and approved this.
And when do we think this will start?
Sometime this week. We're hoping by midweek.
And the strategy you talked about with the face shields, we certainly have enough face shields on hand, but we may have some pretty exciting news to talk about that later in the week.
I think we have some interesting things to share with the audience later this week.
Very good. So there's a lot to talk about with PPE, and Fred has certainly spoken about those things, but there's going to be a PPE education team, and they're going to be deployed to the floor starting as early as tomorrow. There's going to be a lot of educational material out there online. We want to be sure that you understand all of this, and so we're going to come to you, and we're going to give you the opportunity to come to the team as well as be educated. So please look for that and inform yourself and ask us if you have any questions. Good. Anything else to add?
One final thing before you do your sign-off. Can I say something?
Yes, sir.
So the pessimist sees difficulty in every opportunity. The optimist sees opportunity in every difficulty. That's, I think, something that we should think about in the circumstance we find ourselves in. Dennis, who said that quote?
I don't know.
Winston Churchill.
Oh, I should have known that. I should have known that.
I would have guessed you.
Okay, well, we love that quote,
All right.
and thank you for sharing it with us.
Okay.
So that does it for today. Thank you very much, Fred, and we ask you to take care of yourself, take care of each other, and we'll see you tomorrow.